Okay, welcome guys. In this topic, we are going to discuss about the denaturation of the protein. Let's understand what is denaturation of protein is. We can say like this. Say for example, let's say these are the various protein fibers are there. The protein molecules are there. Now what we do is when we go to sunlight, these protein molecules which I have made, these protein molecules will be exposed to the UV rays, or sometime they may be exposed to the heat, or sometime they may be exposed to the X-rays. So all these molecules which I have written, these UV rays, X-rays or heat, they are basically called as the denaturing agents. These are the denaturing agents. So what they can do is these denaturing agents, when the protein is exposed to the denaturing agents, the protein I am talking about, this should be in the either secondary, tertiary or quaternary structure. So if a protein is in the secondary, tertiary, quaternary structure and you expose that to the denaturing agent, what can happen is there may be alteration in the structure. There may be alteration in the structure that you might notice. And this alteration in the structure that is happening because of the denaturing agents, this is called as denaturation of protein. Right? So what is denaturation of protein is alteration in the structure of protein due to denaturing agents. If we expose to the denaturing agent, it will lead to denaturation. Now, what is important to remember? See, the primary structure is having only and only the peptide bond, right? In the secondary, tertiary and quaternary, you have the non-peptide bond also. But in the primary structure, we have only the peptide bond. Peptide is a very strong bond, So it will not be denatured. That is why I have not written the primary structure here. I have just written secondary, tertiary, quaternary. The primary structure is not denatured because it is having only a strong bond, and that is the peptide bond. So let's write down this point, and this is what they ask in the exam, that which structure is never denatured. So we will say that primary structure or the peptide bond, I can say, is not denatured. So this is one point to be remembered, that which bond or which structure is never denatured. The answer is the primary bond or the primary structure or the peptide bond, that is never denatured. Okay. Now once we have understood this concept, let's apply this concept here. For example, let's say these are the protein molecules which are there in the secondary, tertiary or quaternary structure, and that are there in our epidermis. For example, these are the protein molecules present in our epidermis. Now when we go to sunlight, sunlight contains UV rays, that is a denaturing agents, right? So what you will notice that when these protein molecules are exposed to the sunlight, there is no alteration in the structure. So why there is no denaturation? Why there is no denaturation? Just now I told you that when you expose to the UV rays, there should be denaturation. But now I am saying there is no denaturation that is routinely occurring. The reason is we have a protective mechanism. These protein fibers is folded, the protein fibers which I have made, they are folded with a special molecule. This special molecule is folding these other proteins so that the denaturation will not occur routinely. Means when we go to sunlight routinely, the proteins will not be denatured in our skin. The reason is because we have a protective mechanism. This pink color protective sheath which I have made, this molecule is referred as chaperone. This is called as chaperone. So what this chaperone is doing is, chaperone is basically preventing the denaturation, right? So let's write down the details of chaperone. Chaperone is a molecule that prevents denaturation, or I can say that it will protect the protein from the heat, from the UV rays, from the X-rays, right? So chaperone, because it is going to protect the protein fibers from the denaturation, so chaperone is also called as heat shock protein, HSP, heat shock protein, or it is also sometimes also referred as Basically, it is also called as the heat shock protein or the stress protein. Heat shock protein or the stress protein, because it is going to prevent, it is going to protect the protein from the stress or the heat, right? When it comes to the chaperone itself is a protein. Chaperone is a protein that helps in the folding of other proteins, that helps in folding of other proteins. So it is a protein which is helping in the folding. It is helping in the folding so that the denaturation will not occur. When we will go to sunlight, the denaturation will not occur. The reason, because the chaperone is there. If we talk about the examples of the chaperone, example of chaperone, they are such as heat shock protein 40, heat shock protein 70, heat shock protein 90, GRP 94, calnexin, calreticulin. The list is very long, but at least you should remember these. HSP 40, 70, 90, GRP 94, calnexin, calreticulin. These are the examples of chaperone that we have, that is preventing the denaturation process routinely in our body. For the proper functioning of chaperone, we require some enzymes. Means what? Say for example, these are the protein fibers and I want to fold it. I want to fold these protein fibers, and here is my chaperone. Here is my chaperone. So I want to fold these protein fibers via this chaperone. So how to do that? I want to do this reaction so that these protein fibers will look like this. The chaperone will come on them. Right? To do this folding process, we require certain enzymes. So the enzymes which are required for the proper functioning of the chaperone, the enzymes that are required for the proper functioning of chaperone is protein disulfide isomerase, protein disulfide isomerase, and peptidyl propyl isomerase. We require these two enzymes. What we require is protein disulfide isomerase and peptidyl propyl isomerase. If we have these two enzymes, then only the chaperone can easily fold these proteins and will prevent the denaturation. Right? These two enzymes should work. Then only the chaperone can fold the other proteins. So this is what they ask is the enzyme required for the proper functioning of chaperone. Enzyme required for functioning of chaperone. Then only the chaperone will work if these enzymes are there, protein disulfide isomerase and peptidyl propyl isomerase, right? So this is the normal physiology that is occurring in every one of us, that the chaperone is going to protect the denaturation. But sometime what may happen is the chaperone is there, the enzyme is there, the protein is there, but the folding is not occurring properly. For example, what I am saying is, let's say these are the protein fibers, and here is the chaperone. The enzymes are also there. Now the protein folding, let's say, occurred like this. Now this is not normal. This is not normal. Normally the folding should look like this. This is the normal folding. This is the normal folding. But here you can easily appreciate that the folding does not occur properly. This is called as misfolding, or I can say misfolded protein. These are the misfolded protein. This misfolded protein should not accumulate in the cell. They should not accumulate in the cell because they are highly toxic. If misfolded protein accumulates in the cell, they are highly toxic. These misfolded proteins are also called as prions. They are also called as prions. So they will lead to certain disorder. They will lead to certain disorder. So what I am saying is, if the misfolded proteins, or I can say protein misfolding occurs due to any mutation, due to any reason, if protein misfolding occurs. It will lead to certain disorders. These disorders can be divided into two groups. One is called as prion diseases, and the second is prion related disorders. If the protein misfolding occurs, the misfolded proteins, see what I'm saying is, normally the chaperone should fold equally, but if the folding does not occur equally, that is the misfolded protein, and they accumulate in the cell, they will lead to certain group of disorder. They can either lead to prion disease or may lead to prion related disorder. Now what is the difference between prion and prion related? See, prion and prion related, one of the main difference clinically is prion diseases, they are we can say they are very high severity. The severity level is very high compared to the prion related disorders. And the second is the duration. The prion diseases, they will rapidly progress, whereas the prion related, they will slowly will progress. The examples of prion disease, one is something called as Kuru, which is seen in cannibalism. Wherever the cannibalism practice is there are chances that the Kuru disease can occur. That is a prion disease. Cannibalism means human eating humans. That is cannibalism. Then the second is Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease. There are several subtypes are also there, but the important one that we should remember is the sporadic one. The sporadic one that occurs because of the mutation of the prion related protein, PRP. There is a mutation of the PRP gene that will lead to Creutzfeldt-Jakob disease of the sporadic variety. Sporadic. There are some other varieties also, such as iatrogenic. Iatrogenic occurs when, say, for example, there is a patient who is having Creutzfeldt-Jakob disease, and an organ is transplanted from that particular person who is having the disease. We have transplanted, let's say, for example, cornea. We transplanted the cornea from one person to the another person. From the person who has taken, from the person whom we have taken the graft, he is having the prion, the Creutzfeldt-Jakob disease, we have transmitted to the other person. That is called as iatrogenic. It can happen as a variant Creutzfeldt-Jakob disease also. What is variant? That sometimes these prions are present in the bovine meat. If someone is taking the bovine meat, the prions may come from these cattle to the humans. That is called as the variant Creutzfeldt-Jakob disease. And right now we are saying it's sporadic. Sporadic is the most common one. Sporadic is the most common one. That is because of the mutation of the PRP gene, that is the prion related protein gene, PRP gene. The other diseases that comes under the category of prion disease, such as the Gertzmann-Straussler syndrome, Gertzmann-Straussler syndrome, or familial fetal insomnia. Familial fetal insomnia. So these are the examples that we should know regarding the prion disease. Now, when it comes to the prion related disorders, the examples are, the first one is very common, that is Alzheimer's disease. Alzheimer's disease comes under the category of prion related disorders. Now, why it is prion related? Because again, here also there is a defective protein which is going to accumulate, and the protein that is going to accumulate is amyloid beta 42. Amyloid beta 42, that is the protein that is going to accumulate. There is one more protein that is going to accumulate, is the tau protein. So this amyloid beta 42 or the tau protein, they are basically prion related proteins. The course is going to be slow. It will take years together to the symptoms to develop. The neuronal degeneration is going to occur and the symptoms will appear. Then the second we can add is, for example, Lewy body dementia. The second we can add is Lewy body dementia. It is due to accumulation of alpha-synuclein. Alpha-synuclein protein accumulation will lead to Lewy dementia. Then we can add Huntington's disease. Huntington disease. It is due to accumulation of the huntingtin protein. Huntingtin protein is going to accumulate. See, what happens in Huntington disease is on the chromosome 4. Huntington disease is situated on the chromosome 4. There is something called as CAG. This is a codon which is there on the chromosome 4. If the CAG is repeated multiple times, CAG repeated multiple times, there is increase in the repetition of the CAG repeats, that will lead to Huntington's disease. Then we can add one more is the Parkinson disease. Parkinson disease again is due to basically accumulation of the alpha-synuclein protein. That is also prion related disorder. So if the misfolded proteins are going to accumulate, either they will lead to prion disease, that are the Kuru, the Creutzfeldt-Jacobs, the Gerstmann-Straussler, or the familial fetal insomnia. And when it comes to the prion related disorders, here also we are going to have the misfolded proteins are going to accumulate. The severity is going to be much lesser, the duration is going to be much more than the prion disease, such as the Parkinson, the Alzheimer's, the Lewy body dementia, the Huntington's, the frontotemporal dementia is also there. So these are the points to be remembered when the protein misfolding occurs. Now, the next thing that we should know is there is something called as ubiquitin. Ubiquitin. Let's understand what is ubiquitin is. To make you understand the ubiquitin, what I can say is, for example, let's say this is a cell. And it is producing different types of protein again and again. It is producing the different types of protein again and again. So let's say this is one of the protein, and here is one more type of protein. Now what I have did is, the first two protein I have made in the normal structure. Let's say these are the normal one. The third one is not normal. This is abnormal protein. This is abnormal protein. This abnormal protein should not reside for a longer duration in the cell. If it will reside in the longer duration in the cell, it will lead to certain disorder. So we need to destroy it. And to destroy the abnormal protein, the organelle which is responsible for the protein degradation, the name of the organelle is proteasome. Proteasome is basically the graveyard of the protein. It is the graveyard of the protein. So this abnormal protein has to be taken up in the proteasome, and the proteasomal enzyme will digest it up. But the problem is how the proteasome is going to recognize that this particular protein is abnormal, the rest are the normal ones. So we should have a marker. The name of the marker that we have is with the name of ubiquitin. Ubiquitin molecules, ubiquitin is itself a protein. Ubiquitin is itself a protein that is going to work as a marker. What it will do is, it will go and will attach on the defective protein. It will go and will attach on the defective protein. Now once it will attach on the defective protein, this entire unit is referred as ubiquitinated protein. Ubiquitinated protein. This ubiquitinated protein now will work as a marker. This ubiquitinated protein can easily be taken up inside the proteasome. This ubiquitinated protein can easily be taken up inside the proteasome, and the proteasomal enzyme now will start destroying it, and it will be completely catabolized. So this is how the abnormal, or I can say the defective proteins are going to be catabolized in the cell with the help of ubiquitin. So what is ubiquitin? Ubiquitin is itself a protein. Ubiquitin is made up of 76 amino acid. The second point that we can add is, whenever ubiquitin attaches to any protein, if ubiquitin attaches to any protein, that protein is going to die, right? So the attachment of the ubiquitin is called as kiss of death, because if ubiquitin will attach to any protein, that protein is going to die. So the attachment of the ubiquitin is called as kiss of death. That the person is going to, the protein is going to die. That is called as kiss of death. The next point that I can add here is a pharmacological correlation. Okay, before that, the graveyard, or I can say the ubiquitinated proteins, are going to be destroyed where? They are going to be destroyed in the proteasome. So let's write down this point. Ubiquitinated proteins are destroyed in proteasome. Ubiquitinated proteins are destroyed in proteasome. Then the next point is, A pharmacological correlation. See, there are certain drugs which can inhibit the proteasomal enzymes. There are certain drugs which can inhibit these proteasomal enzymes, right? And that are used in the treatment of multiple myeloma. So let's write down this point. There is a drug that can inhibit the proteasomal enzyme. That is a pharmacological correlation. Proteasomal enzyme inhibitor. The name of the drug is bortezomib. Bortezomib is a drug that will inhibit the proteasomal enzyme. Bortezomib is used in treatment of multiple myeloma. Bortezomib is used in the treatment of multiple myeloma. Multiple myeloma treatment, we use the bortezomib. We use bortezomib in the treatment of multiple myeloma, that is a proteasomal enzyme inhibitor. What are the points to be remembered for multiple myeloma? When it comes to multiple myeloma, how to make the diagnosis? That is the point, that what are the clinical features that you have to look for to make the diagnosis of multiple myeloma. Most of the time, the patient will be of 8th decade of life, 7th to 8th decade of life. The presenting age group will be 70s to 80s. The complaint that he or she is going to have is the multiple bone pain, multiple site bone pain. Diffuse bone pain is going to be there. When you will do the investigation, what you are going to find is the patient is having hypercalcemia. There is basically increase in the calcium level. Then there is going to be anemia. Anemia is going to be there. There is going to be renal failure, because these proteins are coming in the urine and they will destroy the tubules also. So that will lead to renal failure. And the bone pain, as I said, the bone pain is going to be there. The reason for the bone pain is because of the lytic bone lesion. So instead of bone pain, I will say there is going to be lytic bone lesions. There is lysis of the bone that is happening. So it is CRAB. I have written the renal failure here. It should be here. So if you write in this sequence, this is referred as CRAB, CRAB criteria. CRAB criteria. C stands for hypercalcemia, R stands for renal failure, A is for anemia, and B is for the lytic bone lesions. So this is the CRAB criteria that is used for the diagnosis of the multiple myeloma, and you may do the electrophoresis also. There you will get the M protein bands that we will get, and based on that we'll make the diagnosis, and the treatment we are going to give is the bortezomib, that is a proteasomal enzyme inhibitor. The CRAB criteria should not be confused with the curb criteria. The CRAB should not be confused with the curb criteria, curb 65 criteria. What is the curb 65 criteria? Curb 65 criteria is used for the admission of pneumonitis patient. Let's say you are sitting in a OPD, a patient comes to you of pneumonia, and now there is a dilemma that whether the patient should be admitted or should not be admitted. Then we use the curb 65 criteria. CRAB is for multiple myeloma, curb is for the pneumonitis admission. So what is this curb? 65 stands for, C stands for confusion, U stands for uremia, R stands for respiratory rate more than 30 per minute, B stands for systolic BP less than 90, and 65 stands for age more than 65 years. So for each of them we will give 1 mark, right? If not, then we'll give 0, and based on that we will calculate that what is the total score. If it is more than 2, we will admit it. If it is more than 3, we will admit in the ICU, right? So curb 65 is used for what? It is for the admission criteria of the pneumonitis, whereas the CRAB is for what? CRAB is basically for the diagnosis of the multiple myeloma. So these are the points to be remembered for the ubiquitin part. Now, next is there are certain techniques that are used in the protein as well as in the amino acid. So there are certain tests we can say. So now we are going to discuss the test or the investigation part. test or the investigation. So the first we'll discuss about the investigation that we do in the amino acid. Investigation for amino acid or the test that we do for amino acid. The first test that we should know is something called as the xanthoprotic test. Let's say if I give you unidentified sample of the amino acid. In the test tube, I give you amino acid and you don't know that which amino acid is this. And I ask you that, find out that which amino acid is this, then you have to apply certain test. Based on that data, you will be able to identify that which amino acid is this one, right? So, xanthoprotic test is done to detect aromatic amino acid. Is done to detect aromatic amino acid. To detect the aromatic amino acid, we will do the xanthoprotic. If xanthoprotic is positive, yes, we will say it is aromatic, it's there. Then, in this xanthoprotic test, we use HNO3 is a reagent. We use HNO3 as a reagent in the xanthoprotic test. Then the second one is, the second test that we do is something called as Sakaguchi test. Sakaguchi test. Sakaguchi test is done to detect guanidinium group of arginine. So if you want to detect whether the arginine is there or not, you will do the Sakaguchi test. Now how it is going to work is, see, arginine contains guanidinium group. Guanidinium group is only there with the arginine, Means if the guanidinium is there, you will say arginine is there, right? So to detect the guanidinium, what we do is we do the Sakaguchi test. So there are two questions that can be framed from this.